Survivorship Awareness Month, I think, is huge. We obviously focus a lot on specific types of cancer, specific tumor types, which is extremely important. But survivorship is a huge topic that affects people with all different types of cancers. And so as time goes on, we get better and better with our cancer treatments. We get more and more cancer survivors. I think a lot of people feel a little bit forgotten after they get through their cancer treatment, but unfortunately, there are a lot of long-term effects from cancer treatment, both mental, physical, emotional, even financial. And so to be able to focus on those things, to make sure that we're still addressing those concerns that patients have as time goes by is really important. So having a month dedicated to that, to really highlight that, is something that I think is crucial. Really, the second you're diagnosed with cancer, you're a cancer survivor. If we get a little bit more into the details, we generally consider 3 phases of survivorship. So there's the acute phase of survivorship, which is where you're first diagnosed, you're still undergoing your active treatment, your surgery, your chemotherapy, your radiation. And we sort of have this subacute phase where you're on your maintenance therapy, perhaps. It's the first couple of years after your diagnosis. And then we have our long-term or chronic survivorship phases. And there are different challenges and different struggles that patients face during each of those phases. And depending on where you are and what those needs are, that's where we're trying to fit in and make sure that we're addressing your concerns in each of those phases. One of the greatest things we offer at Siteman Cancer Center is a survivorship program, a survivorship clinic. So for example, I focus on men and women with breast cancer. When we get patients through their initial treatment, usually a couple of years in, they're going to transition, or I like to say graduate, to the survivorship clinic. They can focus on general health concerns as well as the specific concerns from their cancer. They're going to get all of their cancer-specific surveillance. They'll get referrals as needed to our different programs. And every tumor type is different in terms of when you'd be referred to survivorship clinic. The nice thing is their original provider's always there for them. If they ever need us, we're right there. But when they graduate, our hope is that they never need our services again. But we've still got somebody to take care of them and take them through the rest of their journey. People go through chemotherapy and they're rock stars. They feel great. They have all kinds of support from their family and friends. And then they come in a couple of months later and they feel and even look different sometimes. And it's because this acute network that they had, where there was so much support going through chemo, you finish chemotherapy and then it's sort of like back to normal. But it's back to normal for everyone else. It's not back to normal for you. And so to not have that same level of support is difficult for patients. And it's a whole nother transition. Getting diagnosed is a transition, finishing treatment is a transition, and moving into this longer phase of survivorship where you don't have the same support network. And so it's really important to remember that just because you finished your chemotherapy or just because you finished your surgery or radiation or whatever treatment, there's lots of people who want to support them. Maybe they're not really sure how. And so this awareness month just starts these conversations. So more and more people are comfortable seeking out the help that they need, talking about the assistance, that would be beneficial to them, and really just connecting with everybody in the community.